Hello, my name is Dr. Mark Eldor. Since 2003, I've had the privilege of providing medical care to East Texas families through my medical practice in Athens, Texas. I'm also the owner and medical director of BIOCORE Hormonal Wellness Center, also in Athens, Texas. At BIOCORE, our patients include men who are suffering the unhealthy and unpleasant effects of testosterone deficiency, as well as women who are experiencing the signs and symptoms of both testosterone and estrogen deprivation. BIOCORE is the only hormonal wellness center of its kind in the area. At our facility, we employ the BioT system for hormone optimization. As a skilled practitioner of the BioT method, I've performed thousands of hormone pellet therapy cycles on our patients. Please take a few minutes now to see how bioidentical hormone pellet therapy, utilizing the BioT method, can restore your youthfulness while providing a safe and effective method for hormone replacement and optimization. As you'll see in the video, there is no safer or more effective way for men to undergo testosterone therapy or for women to replace the hormones that their bodies no longer produce.
Subcutaneous hormone pellet therapy represents a major change in the approach to hormone replacement. This difference is so unique that I prefer the term hormone optimization over the conventional term hormone replacement. As opposed to the conventional approach, which more often than not utilizes pharmaceutical products prescribed by your physician, BioT pellet therapy uses bioidentical estrogen and testosterone pellets, which are inserted into the fatty tissue in the hip region. There are several critical advantages to this treatment approach. First, the use of bioidentical hormones, the exact same molecules that your body makes, ensures that the hormone receptors in your body are stimulated in a healthy and predictable way. Secondly, direct release of hormones into the bloodstream avoids what is known as the first pass effect, a phenomenon which occurs when drugs are absorbed through the gut and then go straight to the liver. This can lead to unhealthy side effects and toxicities. Thirdly, pellet therapy allows for a much more efficient absorption of hormones into the bloodstream, which allows for much more optimal levels. One thing that I would like to mention is that although pellet therapy is catching on in the United States, it is still far from mainstream. It is important to understand that many medical professionals do not understand the usefulness of testosterone therapy in both men and women. In fact, medical students and residents, myself included, are taught that women do not need much testosterone to function normally. Furthermore, conventionally they are taught that estrogen therapy is associated with significant health risks and that testosterone use leads to dangerous toxicities and side effects. I myself finished my formal medical training in 1999 and practiced very conventionally through 2011 when I was introduced to bioidentical hormone pellet therapy. I now know that not only are there no significant health risks, but that bioidentical estrogen and testosterone pellet therapy is extremely helpful and healthy throughout the body. As my patient, I just want you to be aware that other medical providers who are unaware of the benefits of bioidentical hormone pellet therapy may give you strange looks and even try to convince you to avoid it. Any such recommendations and comments will be meant to help you, but will be based on misconceptions and confusion. You, in fact, may need to educate them about the fact that tens of thousands of people like you have enjoyed the restorative benefits of bioidentical hormone pellet therapy in the United States over the past several decades. This therapy, which has been popular in Europe as well, is well studied and has universally been found to be safe and effective. In summary of this point, I want you to understand that I would not recommend it, as I have to my friends and loved ones, if I was not 100% convinced of its safety and efficacy. I would suggest that you reassure your other medical providers that, as your physician, I am aware of your medical history, that I have ensured that you are current on your annual health maintenance, and that I am expertly guiding your hormone pellet therapy. So, why undergo bioidentical hormone pellet treatment? Hormone balance gives you the ability to be fully present and productive each and every day, creating wealth and abundance in all aspects of life, financially, emotionally, physically, and spiritually. Every day I see the dramatic improvements in the health and vitality of my patients, and I see their excitement in sharing their knowledge with their friends, colleagues, and family members. What is BioT therapy? It's a therapy that helps your body return to the normal hormonal balance and physiologic state. It's based on delivering the right kind of hormone, bioidentical, in the right amounts, individualized dosing, using the right delivery system, pellets. Every day, 3,500 women enter into menopause. Symptoms of menopause can begin up to 15 years earlier. Male hypogonadism is present in 39% of males over 45 years old, according to the HIM study in 2006. Men lose up to 3% of their testosterone production per year after the age of 35. What you need to know is that, number one, not all hormone therapies are created equal. Number two, hormone replacement therapy is not a one-size-fits-all approach. And number three, you need an expert. So let's talk about estrogen therapy. What are its effects on the female body? Well, estrogen controls for hot flushes. It helps maintain bone mineral density. It helps to maintain memory. It reduces the risk of colon cancer. It helps to maintain collagen in your skin. It increases the neurotransmitters serotonin and dopamine. One thing to remember is that smoking and stress decrease the estrogen in your body. Testosterone is often called the brain hormone. Besides providing major symptom relief, it protects bones, brain, breasts, heart, joints, and relationships. Men aged 30 to 70 will lose 1 to 3% of total testosterone production per year. Women aged 20 to 40 lose 50% of their testosterone production. Yes, that's true. Women make and need testosterone. So then, what are the symptoms of hormone imbalance? Well, it often leaves you feeling tired, having mood swings, experiencing tension. It can lead to a lack of sleep. It can cause memory loss. People often experience a decrease in their sex drive. Depression and anxiety are also common symptoms. People can also experience physical symptoms such as hot flushes and night sweats. It is often associated with weight gain, joint pain, and an exacerbation of migraine and severe headaches. It also causes fatigue and a loss of erectile ability in men. Does any of this sound familiar? Although these symptoms are increasingly prevalent and severe with aging, they are definitely treatable. So let's compare the different methods of hormone therapy. Hormone replacement therapy methods include synthetic and bioidentical approaches. The synthetic products include pills, patches, and injectables. The bioidentical products include pills, patches, creams or gels, and pellets. Why are there so many concerns about the safety and effectiveness of hormone replacement therapy? Where did all of the confusion come from? Well, by and large, it is due to results of studies involving conventional hormone replacement therapy, such as the Women's Health Initiative trial, which finished in 2002 when it was ended early. This study showed a 41% increase in strokes, a 29% increase in heart attacks, a 26% increase in breast cancer. It showed twice the rate of blood clot formation, and a 76% increase in Alzheimer's dementia. It's important to note that after this trial, many women were left with no alternative for hormone balance and symptom relief. Sadly, there have been safe alternative methods available for years. Besides these known risks, what else do we know about the effects of hormone pills? Well, we know that they're associated with peaks and valleys in the hormone concentration in your bloodstream. We know that they're associated with first-pass metabolism. We know that they stimulate breast tissue. We know that when utilizing them, you have to take something every day. They can be associated with vaginal bleeding, blood clots, and headaches. More potential and unnecessary effects of oral estrogen therapy include breast tenderness, an increased risk of endometrial cancer and breast cancer, vaginal bleeding problems, problems with headaches, nausea and vomiting, fluid retention, blood clot formation, leg cramps, and gallstones. What about hormone patches? We know that with patches, estradiol levels can be better than with pills, but not as good as with pellet use. They can be associated with adhesive problems. They need to be changed throughout the week. Some patch users experience weight gain, but generally there's less fluid retention than people experience while being on synthetic or horse estrogen. It's also important to note that 45% of people do not even absorb hormone through the skin. So, what about creams and gels? They too have the advantage of avoiding absorption through the gut, but they have their own problems. You have to wonder if you applied enough. You have to remember to rub it in daily and sometimes twice daily. They have a short half-life. They are applied topically onto the skin, but often people don't know how long they have to wait to get dressed. They can sometimes be transferred to others, such as babies and pets. Most important, estriol, which is one of the components of BIOCORE, doesn't even have the protective effects on bone, heart, and brain. Testim is an example of a transcutaneous testosterone product which is used in men with low testosterone syndrome. Not only is this product expensive, inconvenient, and bad smelling, you can see on this graph that even at the higher dose, it only increases serum levels minimally. The goal of BioT treatment in men is to achieve a youthful testosterone level of 800 to 1100, and we have no trouble achieving those levels with pellet therapy. So it is obviously a much more effective treatment option. Currently, another popular treatment option is injectable testosterone suspension. Injections can certainly increase testosterone levels, but they have a number of disadvantages. They can be associated with uneven absorption. They can be associated with a significant roller coaster effect. They are synthetic hormones, and they have significant adverse effects, including liver toxicity, coronary artery disease, prostate cancer, and many others. Anabolic steroids cannot be aromatized, and therefore they are very dangerous. This has been proven in many studies. They've been shown to elevate LDL and decrease HDL. Also, injections always wear off before the next time the shot is due. So why do we at BioT advocate pellet use? Pellet therapy keeps the estradiol to estrone ratio at 2 to 1, which is the natural ratio. These hormones are biologically identical to the natural hormones that your body produces. They're derived from yams. These pellets provide hormone that is constantly available to the body. They're absorbed directly since they're not taken orally. They provide a steady state of hormones, so patients don't experience a roller coaster effect. They're associated with minimal weight gain, if any. They're safe and hassle-free. They provide for individualized dosing. And of course, they last much longer than any other treatments. Let's briefly talk about the history of hormone pellets. These pellets were developed in 1939 for women who had undergone radical hysterectomies. Historically, they've been widely used in Europe and Australia, but they're definitely gaining momentum here in the United States. It is well known that in order to optimize hormone deficiency symptom relief, one must achieve relatively stable hormone levels. It is best to avoid the peak and trough phenomenon. No one feels good when their hormone levels keep going up and down, giving them a roller coaster effect. The problem is that with all other methods, that is exactly what you get. A sharp rise in levels after the dose is administered, followed by a continuous fall until the next dose arrives. Patches and topical creams are better than, say, pills and injections, but nothing else compares to the smooth delivery from pellets, which last around 4 months in women and around 5 to 6 months in men. Besides the excellent delivery of an optimal amount of estrogen and testosterone in women and testosterone in men, pellets have many other advantages over other hormone delivery systems, such as they're associated with no increase in thrombotic activity, they reduce cardiovascular risk compared to oral therapy, they do not increase the risk of breast cancer incidence. We have known for decades of the relationship between estrogen and protection against decreasing bone density. However, what most providers don't realize is that testosterone is an even better protector against osteopenia and osteoporosis. In fact, studies have demonstrated the 4-fold increase in bone density over oral estrogen therapy and 2.5-fold increase relative to patches. In fact, one can achieve an 8.3% per year increase in bone density with pellet therapy, compared to a 3.5% increase for patches and only a 1 to 2% increase with oral estrogen. Let's address safety regarding breast cancer. The Nurses' Health Study was performed with 121,700 nurses, and it showed definitively that conjugated estrogens were associated with an increased risk of breast cancer, with a relative risk of 1.32. Studies have shown that estrogen plus testosterone in pellet therapy are associated with no increased risk of breast cancer. Another study was published in the Archives of Internal Medicine. It showed that oral synthetic chemical methyltestosterone increased the risk of breast cancer. Products utilizing this compound are Estratest, Estratest HS, Syntest, and Syntest DS. The study, however, showed that non-oral testosterone prevents the stimulation of breast tissue and actually lowers the risk of breast cancer. So not only is there not an increase in the risk, but there actually is a protective effect that was demonstrated in this study. This is much different than what we saw in the Women's Health Initiative when oral Prempro was the drug that was studied. Because of the controversy about hormones, and because this is such an important consideration, let me re-emphasize these points regarding the safety from a breast health standpoint. There are hundreds of studies, all with the same take-home message. Testosterone delivered by pellet implants does not increase the risk of breast cancer, unlike oral synthetic methyltestosterone. Testosterone implants have shown less stimulation of breast tissue, and treatment with testosterone and estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. What do we know about cognitive function relative to hormones? Well, we know that women get Alzheimer's disease approximately 8 times more often than men. We know that women on testosterone are 50% less likely to develop Alzheimer's disease. We know that men with low testosterone are 3 times more likely to develop the disease. We also know that testosterone use is the most effective treatment for memory and concentration problems, which are increasingly common as we age. Okay. So, those who want to improve mental clarity and memory deficits arising from menopause and andropause, as well as protect themselves from senile dementia and Alzheimer's disease, should strongly consider testosterone therapy. One symptom that many people don't realize is related to hormone deficiency is joint pain. It is true that joint damage is related to cumulative trauma to joint surfaces, but joint reparative processes definitely slow down with age and with worsening hormonal deficiency. In fact, 10% of men and 18% of women greater than 60 have osteoarthritis. It's been estimated that by 2020, osteoarthritis will be the 4th leading cause of disability in the United States. Science has shown us that chondrogenic progenitor cells are present in arthritic tissue, and that both estrogen and testosterone can stimulate these cells. Of course, in men, we must be concerned about any potential risks relative to the prostate gland. Studies show that high levels of circulating testosterone are not associated with increased prostate cancer risk. Also, that blood levels of androgens are not related to the risk of developing prostate cancer. One study showed that after 1 year of testosterone replacement therapy, men with PIN, a precancerous condition, do not have a greater increase in PSA or a significantly increased occurrence of prostate cancer compared to men without PIN. These results indicate that testosterone therapy is not contraindicated in men with PIN. So we've talked about safety, but what exactly can male patients expect from treatment with bioidentical testosterone pellets? Well, they can experience enhanced erectile ability, protection for the prostate, enhanced libido, protection for the cardiovascular system, increases in bone and muscle strength, cognitive clarity, lower cholesterol, increases in energy and vitality, a feeling of overall well-being, reductions in body fat, and relief from depression and anxiety. What about the positive effects of combination estradiol and testosterone treatment in women? Well, they can expect relief of hot flushes and night sweats, increased energy, improved libido, improvement in sleep, relief of vaginal dryness, bone protection, increased lean body mass, reduced body fat, breast protection, and cognitive clarity and long-term cognitive protection. So why is bioidentical hormone replacement therapy using the BioT subcutaneous pellet method gaining such popularity and causing so much excitement? Because patients are talking to their friends, spouses, coworkers, and loved ones about their increased energy levels, restored interest in life, increased sexual desire and sex drive, consistency in their moods with relief from anxiety and depression, their increased mental clarity, their decreased body fat, and their greater capacity for getting the body in shape.
Okay, so what do you think? Is this too good to be true? It can certainly seem so. Sometimes it's hard to believe that a medical hormonal therapy can be this effective throughout the entire body while remaining essentially painless and risk-free. I have to say that initially I was skeptical. The more I learned about the BioT method, however, the more I came to realize that BioT is based on sound clinical evidence and medical research. One word of warning, however. You'll almost certainly be exposed to other medical practitioners who just plain don't understand bioidentical hormone replacement therapy. They may advise you to stay away from it and not become involved in this type of treatment. They'll have your best interest in mind, but you have to understand that this kind of advice is due to their confusion and misunderstanding about hormone therapy in general. My advice to you is to put your faith in me, an experienced, licensed, board-certified practitioner who has years of experience in BioT. I've come to believe in BioT so much that I've endorsed it to my colleagues, employees, my closest friends, and even my family members. I believe that your decision to undergo therapy with BioT will be one of the most important decisions that you will make regarding your physical and emotional health, your longevity, and your overall sense of well-being. I look forward to being your BioT practitioner, and it's my solemn promise that the treatment and advice that you receive through BIOCORE Hormonal Wellness Center will always be safe, effective, and life-changing.